So and also, why feeding the baby? There is something I forgot to say. Why feeding the baby? You should make sure you wrap the baby to avoid his or her hand obstructing the feeding. So I really want to do the gavage feeding. Dropping it accordingly. This is the tissue, this is the straight, then this. So my stethoscope. So starting it, first of all, check the physician's order. So after checking the physician's order, what is there to check? So I check for the concentration, the amount, the type, and the frequency of the tube feeding in the patient's chart. So then after doing that, what is the next thing? The next thing is definitely the mother might not be in the same room with the baby. The mother is in another room. So what do I have to do there? I have to check the involvement of the mother to the baby, then ask the mother the name. That, and also this is where I can now get the baby's milk, and also to make sure that the milk is not hot, is not cold, is room temperature. So then after that, then what is the next thing to do? So I've gathered my equipment needed, my stethoscope, my syringe, the milk, then the tissue. So then what is the next thing to do? So the next thing to do, then I now need to hand washing. So after that, then I dry my hands, then put on my gloves. After which, what is the next thing? The next thing is placing the patient in a semi-fowler's position, so which is about 30 degrees. So the next step now is to check for the placement of the NGT. Before that, I place a tissue. I place a tissue on the baby's chest. So after that, what is the next? The next is placing the syringe. I kink, so open. And what is the reason? Not to allow airflow. Then I release. After releasing, then bam. Then I allow. So what am I expecting? I expect kilocalories. So at the end, I push back in. So then I kink again, take out, close. So what then? This is now time to also check using the stethoscope. So take this up there, kink could already put. Then I aspirate. So when it's done, I should hear grumblings to show that it's correctly placed in the abdomen. So then after that, I kink again, take out, close. Then this is now time to take out the plumbing. Yes. So what is necessary now? To kink again, open, release. Before you release, you add a little quantity of water, about 5 cc. So you add water, then you release. Then as it's flowing, when it gets down to 1.1%, you kink again. Then this is now time to add the milk. Maybe the doctor prescribed 30 cc. So that means if this is 10 cc, this is already 30, then is completely 30, is 30 cc. So afterwards, then when the milk is almost about to finish, so if the medication is given to the baby, then I then put the 5 cc of water, the last one, in order to flush. Then when it's almost done, then I take out, then lock, then release. Then in doing all of this, and also while feeding, just as I said, it should be just the eye level, just as I did. So then, if the feeding happens to be difficult, then I had to use the plunger, but a little, not heavy push, like just little push and not force it. So after doing this, then while feeding, I should check for feeding intolerance with the baby, how the baby was responding and how difficult it was to flow in. So then in this procedure, if some nurses might facilitate popping, but I kinked effectively, so there is no need for popping. So then after doing this, then what should be the next is to clean up the baby. Then as well, then make sure I place the NG tube in the right placement with heat. Then after doing this, so what should be the next? The next is placing the baby. The baby is already in 30 degrees. So before I place the baby, what should I do? I should ask the medical practitioner what position is necessary to place the baby. So afterwards, what do I do? Then it's now time to do the clean up. I've already placed the baby. Maybe the medical practitioner said back sideline, so I placed the baby. So afterwards, what is the next? The next is then clean up, then dispose this, remove my hand gloves, perform my hand hygiene. So afterwards, what should I document? I document that by 3:50 a.m. I gave feeding feeding without obstruction, then to his or her name. So then after that, I document the reaction of the baby.